An 8-year-old little girl that's being brought in by her parents. She was at home and complained of a very, very, very bad headache, followed by 3 bouts of emesis. And then, so her parents were like, well, let's get her in the shower. We'll get her to the ED because she had vomit all over her. And in the shower, she basically became unresponsive, still breathing, but just unresponsive. So she kind of like fell, slumped over in the shower. Parents dried her off and scooped her up. They lived literally in the backyard of y'all's ED.
Like breathing or breathing?
No, she's breathing. She's just like really won't respond to any stimuli.
Okay.
But her breathing rate and effort are normal.
Get her set of vitals.
Okay, so let's turn the monitor
Wait.
on.
Does she have any medical
Blood pressure,
conditions?
respiratory.
She does. She recently was diagnosed with ulcerative colitis. She was seen at Cook's last month.
It's
she
the same
was.
kid, isn't it?
What'd she say?
She said, oh, it's the same kid.
I was in this mood. I was like, this is a different patient. This is what we gotta do.
Hey, I'm gonna change it up. She's an 8-year-old, so she weighs 30 kilos instead of
So
24.
now you gotta go off the weight.
Which would be, how do you find
It
the
may
white on the
fa-
colors?
It may fall into
Go
the same
backwards.
category.
You're on the wrong side.
Yeah, there's your weight.
Okay.
Yeah.
So
So what'd I
30
say?
kilos.
30 kilos?
Yeah.
So she's
green
here.
now. Okay.
Okay.
Ulcerative colitis.
Yes, ulcerative colitis. Spent a week at Cook's. Ended up getting treated with PRBCs and some steroids. She's now at home on her autoimmune regimen for ulcerative colitis and doing fine. I mean, she's gone back to school. She looks great. All the things. So this was kind of out of the blue.
Any injury?
Not that they're aware of. However, mom and dad had stepped out to go get like towels and stuff when she fell. So it was kind of unwitnessed in the shower.
Okay. Yeah, we're probably gonna do your head CT.
Okay.
If bottles and stuff are stable. Is this her?
Yeah, they're stable.
patient?
So CT.
Yep. Okay. So
Push that
118
button.
over 77.
Oh.
Well, it's
I'll
up
have
there
it here,
too.
118 over 77.
mhm,
And she's still unresponsive.
she is.
So we're
And
doing an assessment.
In CT, she has a hypertensive episode where she has some intermittent bradycardia and almost like seizure-like activity. You aren't real sure what's going on, but a little bit of posturing and.
No.
So we want to protect airway.
Oh.
Oh god.
Oh.
Definitely
go.
protect
Oh,
airway.
So,
Bag.
No,
Bag-
bags.
bagger.
They're probably bagged
Okay.
at
We're
this
gonna
point.
bag.
Her respiratory rate's 6 and her sats are in the 60s.
We didn't give her anything.
All right.
do we have
so
an IV already established?
We don't, but we can. Yeah, I think
Let's
that's
do
a good
that.
idea. So we get an IV.
Doink.
Someone's managing her airway, which is great. So you're bagging, let's say, at a rate of, put her up to 15. All right. Heart rate's back to being normal. However, blood pressure is still very hypertensive. CT came back, and you guys already have results, and it did not show anything.
They just
So
did
is
head
that still her
CT
oxygen
or
while
abdomen
backing?
too?
They just, well, we can say they did both, but it was unremarkable. Everything was great.
So, is
What
her
was she
oxygen
doing when
saturation
she-
going up at all with bagging?
Her sorry, I meant to fix that. Yes, her oxygen is
Just like,
I know, I'm doing terrible. I opened the airway,
I
I
say,
swear.
if not, we only
I
have one
swear.
other option.
Oxygen is 95.
Are her lungs clear?
Lungs are clear and equal.
Blood pressure meds.
Okay, what do we want to give?
What do you give to children?
Same thing as
They're not
adults.
supposed to have this.
It's the same as adults, just pretty much dosing down.
Yeah, we could give hydralazine. We probably do
Hydralazine.
labetalol.
Labetalol is probably.
Maybe nicardipine.
See labetalol on here.
Pain, overdose. Nope.
Because kids aren't supposed to have this.
I guess we would stop bagging and put maybe like a non-rebreather or something, see if she responds.
Yeah, but we could. So, however, before she took over breathing, she only had a rate of 6, and she's still completely unresponsive.
So this
Oh, then we
respiratory
don't do
rate
that.
is with her bagging.
Correct.
Bagging, yeah.
Oh, then we do that.
I mean, you can certainly take it away and try and see what she does.
No.
We have not. We have not done any lab work. So
We would
did
have
we
pulled
give?
labs when we started.
Did we give our antihypertensive guys gave one.
There's not one on here, but let's say sure.
Please.
Any of them at all?
There's none on here.
None on there, really?
No.
Who brought your card, the card from downstairs? Anyone?
Oh, I did.
Reference cards in the back there? Probably has your dosages we can use. And you guys can pick what you want. There's hypertension, just pick a drug in there.
Yeah, let's do Label.
Okay,
They weigh 30 kgs.
30 kilos.
So 0.2 mg per kg, max 40 mg dose.
Okay, so we give that.
Push. Wonderful.
Flush.
Blood pressure is 136 over 86 now. Heart
Okay.
rate's 93.
Okay.
We're at 96%.
Is she still not
But we're
breathing
still
back
afebrile,
very well
correct.
on her own?
Correct, not breathing well on her own,
So-
afebrile.
At this point, how if we just had to like keep bagging her?
Respiratory
Did the doctor just want to intubate her?
Yeah, we
If
could,
She can't. if
certainly,
She can't
we
do anything,
can.
We can't just
mhm.
keep bagging her.
Yep,
for-
so
Especially
everyone,
if she's ever
everyone can kind of prepare for an intubation, for sure. Okay, and so you're starting to see that seizure-like activity again.
Cupra.
Okay,
Ativan.
yeah,
Yeah,
Ativan.
Ativan. I'd prefer Ativan before.
2 milligrams
Okay.
per ml. So
No history
3.3.
of seizures?
mm-mm. Nope.
Need a sodium level. The glucose.
Yeah, are labs back yet?
Did we check
Labs.
the glucose?
Labs are back, glucose is
Oh, it's
115,
not bad.
sodium's 136.
Oh,
Not either. Not bad either. Shoot.
damn it.
Everyone's sitting here going, what is wrong?
What medications was she?
Likes, what'd you guys give Ativan? She likes her Ativan. Her little seizure twitches are gone
What
away.
meds was she taking for the ulcerative colitis?
Yeah.
Good question.
Okay.
Okay, so
Irrelevant.
that's
Sure.
Sure, she
Normal.
was taking the right amount.
Yeah, I mean, we're pretty sure the
Okay, so it's
parents
not
were
that.
administering that.
Yeah.
Maybe.
Yeah, did she
We did a drug screen, nothing showed up there.
She wouldn't be hypertensive though. Everything would be depressed, right?
No.
What's happening?
Pressure's changing.
It's
Going
just
back
going
up again.
increased IC.
I'm not bagging that fast. I don't know what's
Would
happening.
it be that? Would it be
So
that?
have we intubated her at this point?
our line,
We can say we intubated, but she's not on vent, so someone's
Okay.
now bagging through an ET
This is
tube.
like autonomic
have-
dysreflexia right here.
Oh shoot.
There we go.
Okay,
guys.
so more blood
Alright,
pressure medication to lower
Okay,
it?
So go ahead and
Let's
get the
repeat
pads. I want the
Lavable.
pads.
Yeah, let's have those
I'm
on.
not a good doctor, y'all.
Let's get some pads on.
Well, this is as
Well,
Just
in case we need a
Yeah.
cardiovert
Always.
ourselves.
And does
So let's go back to what the event was that brought her here.
had a
Possible
headache.
fall.
She had a headache. She was thrown up. I mean,
Worst
that-
headache of her life.
Increased
Three vomiting episodes.
but the CT was
The
negative.
CT was
negative.
negative. Some seizure-like activity. So what do you guys want to
Like-
assess? What do you think is related? What kind of
That's
kid
like
is this? You had to
neuro.
just neuro, right? So let's do a
Neuro.
neuro assessment. What things are we checking neuro-wise?
Eyes.
Okay.
Pupils.
Tell me what her pupils look like.
Is it actually
They're unequal.
Okay, so the left is what size?
Like, big.
Was it
Okay, so
blown?
it's 6 and blown.
Six
And
and
her
blown?
right one is a 3 or a 4 and
Mannitol.
responsive to light. So what are we showing signs of?
Herniation.
Yeah, increased.
Increase in her cranial pressure of some variety, right?
So we can give
You said
33 grams of mannitol.
Honestly.
Ah, Anna!
I mean, I'm just over here in the corner, but it's fine.
Stop.
All right, so she's intubated. She has some seizure drugs on board. We're giving her
You could give
mannitol.
And then
Okay, yes.
Consult with
And then
the
give
3%.
3% saline.
Or 3%
if you want
saline,
saline.
Yeah, I was
Yes.
gonna say, let's do fluids
And
with
we
it
do
too.
3% over mannitol typically.
Okay.
That's just one of those things that has swung back and forth. It's probably provider driven, but our medical director prefers 3%. So that's
So
what we
fluids
typically
over-
do.
Have you
LASIK
guys
helps with
shown
that?
any benefit
LASIK helps with
in
that? I did not know that.
hyperventilating patients?
I mean, I guess
with
We would do
ICP?
it for,
It makes
if you
sense.
had an
Like in the
ICP
clinic.
monitor and you had a temporary spike to get it back down, we would, but not consistently.
Okay.
It's not proven to work. We would do other things to get it down consistently. But if she had like a spike into the 40s and we just needed something real
Just for like
transient,
a brief moment to try
yeah,
it.
then we
Okay.
would. Yeah. Like sometimes that happens when you are going to imaging, and like they'll be in the middle of the CT scanner, and you know what else do you do? You're either going to give drugs or hyperventilate. But
Okay, but what's
not for a long
causing the
period of
increased
time.
ICP?
Yeah, let's get back
Are
to the
there
I
rates
was
other
saying
for
that's
tests
sure.
that we
surprising
can
that
do?
you're
So
like a
yeah,
second CT?
so
an
CT
MRI?
didn't show anything, but you guys have MRI.
Yes.
Okay, so MRI. Let's say we did that. Okay.
Okay.
It's like-
So MRI comes
syphilis or
back. She
something.
is stable. So she's stable now. She's on her mannitol, and other than having unequal pupils.
Does water show on CT?
So on CT, what sometimes appears, on MRI, what sometimes doesn't show up is real small, like cerebral vascular events. This particular patient had posterior reversible encephalopathy syndrome, which is basically bleeding, but it's not from an active bleed. Does that make sense? So an autoimmune patient that receives PRBCs or any other sort of patient that has a massive transfusion, so think of like traumas or moms that have placental abruption and they receive blood transfusions, if they have an autoimmune disorder that for some reason triggers this posterior reversible encephalopathy. So basically, she had a transfusion, and that blood, instead of acting normal in the body, like you would get a blood transfusion and your body would absorb it and use it appropriately. And this particular syndrome that is reversible and it is transient if you can catch it early enough, the blood pools in their head.
Oh, wow.
And
Did
so
they give them some education about that after the patient left?
they did. Yes, they did. The patient ultimately ended up passing away. It was very, very sad. And it was, we had to pick it up and get it to cook. But yeah, she had already herniated.
This is
Yeah,
a real.
This is a real patient.
Oh, now it's sad.
But here's the whole lesson on this. You manage her symptoms, right? So our CT was not helpful.
No.
It did not tell us anything, but it's a neuro kit.
You know it's neuro.
If it's a bleed, if it's a stroke, we picked up 3 strokes in the last 2 months. So kids do have strokes. If it's a trauma, if it's a head injury, if it's a tumor, they all are going to look and respond the same. They're at risk for temperature instability. They're at risk for seizures. They're at risk for hypertensive crisis. They're at risk for herniation. All of those things. We don't need to know the underlying diagnosis. We just have to know she's showing signs of intracranial pressure increases. How do we manage that? Treat the seizures. Keep her normothermic. Give her antihypertensives. Give
What's
her
your target
sedation.
blood pressure?
Blood pressure, all of them are age related, and so you have to go off of
I
their
mean, like
age.
if they're
So I don't have it
having like
memorized.
It was
hypertension,
eight.
like I know sometimes with adults they want like permissive hypertension.
8 would be 110.
Not
you
for a
apply
head
that?
kid, probably
Okay.
not.
So
no.
anywhere
You would want
top
a normal
number 97 to
okay.
115.
Yeah,
There you
I'll
go.
say 110.
72.
110.
And she was in the 200s, so that was,
Yeah, we-
even striving for like 120, 130 would have
Yeah.
been better than
Yeah.
what she was
Yeah.
at,
Yeah.
for sure.
Probably worse.
Would your transport team want us to have the MRI?
If it doesn't delay care.
Okay.
Yeah, if it doesn't delay care, then we're fine with it. If it's going to delay care, or if you don't feel like you can get a good image because the patient's not sedated enough or something like that.
So say, I know we were
It's
already
hard
kind of
'cause
stable and called
sometimes-
Joel.
Yeah, and then and we're close enough. We would helicopter here that we would be
Yeah. As
close
soon as the
enough
parents
that
walk
probably
through
an
the door.
MRI you wouldn't even get through that whole
Yeah.
exam. So we would rather have like an IV
We
and
would've called you
some
when they
lab
would
sent than to waste time doing the imaging, because we're most likely going to redo it at Cook's anyways.
Yeah.
Yeah, or we don't really have an MRI, stat MRI
Correct.
set up very well.
Correct.
So.
Yeah. Yeah. So I just work on like the other stuff.
Mm-hmm.
So very good. So focusing on kind of her history, what brought her in, it was a little bit different and perplexing.
I'll say
Um,
it's not. I mean, I guess if you base it off the fall and then the fact that she recently had the transfusion,
Correct.
Then you could maybe.
But this syndrome is so
So
rare, you're
wouldn't-
probably not going to pick up on that.
I'll say
what
there
it
ain't no
was.
way I
So
would have said.
things
I was
that we
thinking
do
of
know
bleed the
is she
entire
has
time, yeah.
some event at home, right?
But I
Exactly, and it could have been.
Yeah.
But
The worst headache of your life
Yeah.
tells you that
Headache-
there's some
Well,
Well,
usually
and-
with headache and vomiting, it has
Yes.
to
we
do.
think stroke too with
Yeah.
that, with adults. That's what you
Yeah.
definitely think. Complain of the worst headache. I mean, she's definitely had some sort of change neurologically speaking that kind of had that that history.
glad my four-
However, there were some other things that happened,
Yeah.
seizures, so then what's causing the seizures? Does she
Yeah.
have a tumor? Did she have the fall?
Yeah.
So it's one of those, like, what comes first, the chicken or the egg? We really don't care.
Yeah.
We just wanna
wanna
treat
treat.
the
So,
symptoms,
Not
so.
to change the subject, but how do,